For decades, Medicare kept a specific list of procedures that must be done inpatient because of the risk, the recovery, the complexity, and the clinical reality that you cannot send people home safely same day after certain surgeries. So CMS has now eliminated that list entirely. So, according to Modern Healthcare, the agency says that the science has outgrown the list. So, they claim medical advances make recovery quicker, surgical techniques safer, and outpatient centers more capable. So, they want to modernize and give hospitals, quote, more flexibility. Here's the problem though. Flexibility for hospitals is not the same thing as protection for patients. If a procedure is no longer required to be inpatient under Medicare, hospitals and insurers can fight over status. And when they fight, the patient loses. So this change shifts risk onto seniors, disabled patients, and anyone with complex medical histories. If the hospital places a patient as an outpatient observation for a surgery that used to require admission, they can face higher out of pocket bills. They may not qualify for Medicare covered skilled nursing facility care after. They may get stuck appealing denials for care that used to be automatic. So CMS says they'll monitor trends to avoid harm and keep an eye on what surgeries end up being done outpatient. But if you've worked in healthcare for 5 minutes, you know reactive monitoring never protects people in real time. So the disappearance of the inpatient only list hands insurers even more power to push patients out faster, deny coverage, or mark major surgeries as outpatient appropriate. And nurses, case managers, and hospitalists will be left holding the mess. If you care for older adults, complex patients, or anyone who struggles to afford care, this matters. And if you work in nursing, case management, surgery, or revenue cycle, brace yourself for more insurer fights and more patients blindsided by costs they never expected.